Memorandum. 2. All hospital supervisory personnel. From Margaret O'Brien, Infection Control Department. Subject, an institutional response to AIDS. Within 10 hours of the admission of our first AIDS case at Memorial Hospital, it was distressingly clear that this institution is in serious need of policies to deal with the psychosocial impact of this disease. The patient in question, a 22-year-old gay male, was transferred to Memorial from a Chicago hospital at the request of his parents, who are local residents and have taken over payment for his care. Upon arrival, he was admitted to our intensive care unit. We have Dr. Miller here. He's here from infectious disease. He's here to talk to us all about our AIDS patient. I know this is the first time any of you have had any experience with this, and so we wanted him up here to give us some information and answer any questions any of you might have. Okay, Dr. Miller?
Thank you. This is a young man who has acquired immune deficiency syndrome. He's developed secondary pneumocystis pneumonia, and he is currently ventilator dependent with an ARDS picture. I think based on the experience of the physicians in New York and San Francisco, we have to conclude that his outlook is essentially hopeless. It's important at this point to begin thinking about what approach we should take to caring for this patient. The Center for Disease Control has told us that patients with AIDS should be treated much like patients with hepatitis B. There is absolutely no evidence of transmission of AIDS to any health practitioner. I think that it is very important that we, as the people who are providing primary care for this patient, focus on his needs as a sick young man and put behind us both our feelings about his homosexuality and also any unreasonable fears that we might have about AIDS.
Gonorrhea, 1979. Shigellosis, 1979. Non-specific urethritis, 1979. Syphilis, 1980.
An initial staff briefing by Dr. Miller was helpful, but it's going to take more than briefings to prevent anti-homosexual bias and fear for personal safety from interfering with our professional obligations to our patients.
Herpes genitalis, 1984. AIDS. How'd you like to take this fellow home to your mother?
John, can you tell me what brings you to the emergency room today?
Well, I've just felt like I've had a cold for like a month now. I've had some fever.
Do you know what your temperature is?
Although we've had no local confirmed cases of AIDS at Memorial, we have been seeing increasing numbers of homosexual men in our outpatient clinic and emergency room. Men extremely concerned about their health because the early symptoms of AIDS often mimic those of the flu or a cold.
Just generally, I just haven't been able, I've been trying to take care of it, and I just can't get rid of it.
Charlie McAdams called and he wants to see you, and it sounded kind of urgent, so if you can get in touch with him.
Thanks. Given our experiences in the outpatient clinic, and now a confirmed case of AIDS in the hospital, I expected some problems from support services, but I didn't expect them to come quite so quickly.
Hi. You needed to see me, Charlie?
Yeah. Chewy almost freaked out when she got a bag of mop heads and cleaning stuff marked AIDS. She wouldn't touch it. I didn't know what to tell her.
But who marked the stuff AIDS?
Your guess is as good as mine. Housekeeping, I suppose. What are we supposed to do with that stuff?
Charlie, you just treat it like anything else that comes down from isolation. You just put the inner bag into the washer and wash at 160 degrees in standard washing formula, and then you burn the outside bag. The stuff shouldn't have been labeled AIDS to begin with.
Yeah, well, would you have a little talk with Chewy about it? She's about to quit on me. Can't say as I blame her. I heard about the guy they brought in.
What do you mean by that, Charlie?
Well, he's not exactly an Eagle Scout, you know. Is it worth taking chances on a guy like that?
Oh, for God's sake.
Does he just look thinner to you, or?
Yeah, he's lost a lot of weight. Maybe 15 pounds.
Do you have anything that you want to add as far as what's been happening with him?
No, it's, I know, it's kind of scary. I don't know, I'm just worried.
Our standard operating procedures for handling contaminated materials are well defined. but unreasonable fear of exposure to AIDS was interfering with our procedures, creating the potential for disruption of hospital routine.
Chewy! Charlie says you're upset about something. What's the problem?
Well, what am I supposed to do with this, huh?
Oh, mark that stuff that way. You're supposed to wash it just like you wash anything else that comes down from isolation.
Oh, not according to Charlie. Now, he said nobody knows what causes this disease, and that he said we should take this faggot stuff and burn it in the incinerator.
Come on now, Chewy, that's unreasonable, and Charlie knows it.
Well, then you better get down to Capital Laundry, because he called them and he talked to Jerry Martin, the foreman, and he told him to be expecting a bag of soiled bed linens marked AIDS, huh? And if that happens, I don't know what we're going to do. We're going to run out of sheets.
Oh, come on. That's ridiculous.
Well, then what am I supposed to do with this?
What are you supposed to do with it?
Yeah.
Well, I tell you, you and Charlie today, you're supposed to do with it what you always do with it down here. Take the inner bag, it's water soluble, dump it into the washing machine, take the soap, put it into the washing machine, then burn the outside bag, okay?
Okay, okay, good. That's
Okay,
right.
one less problem.
Okay.
See ya.
I'm going to burn the shit.
Have you ever had anything like this before?
My glands have swollen up occasionally, like whenever I get some kind of infection, usually my neck glands swell.
How long do they usually stay swollen, though, after you've been sick?
This is the first time that I really felt like that they've stayed, you know.
Because you've got about 3 right over here. That doesn't hurt, right?
No.
Okay, and you have about 4 over here. Okay, so you got quite a few there.
The strong negative reaction from some of our support personnel increased my concern about similar problems with critical care staff.
Is everything clear in the isolation procedures?
We're doing the best we can.
Do you have any problems with any of the other nurses?
Things seem to be going okay.
I think we'll order some blood work on you right now, probably a CBC, and that's just a complete blood count. We'll do a throat culture on you, and probably also check for mono, just to make sure that that's not a possibility there. Okay?
What are the chances that this is AIDS?
Hello, Margaret O'Brien here. Who is this?
Shortly after lunch, I found myself faced with a situation involving a gay employee which none of our policies prepared me for. I wasn't sure then how to deal with it, and I'm still not sure.
Okay. Yeah, all right.
From that point on, things fell apart so quickly that all I had time to do was react.
Do you know who called?
I have no idea who called. I just want you to know, we have our first case of AIDS. You've heard that. It's in the hospital this morning. So, naturally, people are going to be suspicious when they know that you're gay and when you're sick.
No, wait a minute. Just because I'm gay and sick doesn't mean I have AIDS. I don't have AIDS. You know what? I don't have AIDS.
Yes, but you're working down here in emergency. You have contact with people.
Yeah, but I don't have AIDS, and that shouldn't become an issue. So people are calling up me, checking on me. What am I going to lose my job?
I didn't say you're going to lose your job. All I'm saying is you have to understand that people are going to get upset. If you're openly gay, you tell people you're gay, and here you are and you're sick and you're working around blood and very sick people in an emergency room, Mark. Now be reasonable.
But you know I wouldn't come to work if I was that sick. Besides, I don't have AIDS. You know that.
Well, I know that. I understand.
Well, then why did you come down and ask me about it? Do you have to go ask straight people that are working in the hospital if they had a little bit of sniffles, that if they might have AIDS, you know, maybe stay home for a couple of days until this public furor blows off? No, that doesn't make any sense, Maggie.
I understand this is going to be a problem, but you also have to understand from my point of view what we're dealing with.
I know,
here.
but suddenly it feels like you're making me feel responsible for this whole problem, and it's not my problem, it's the public's problem, because they don't understand what AIDS is about.
Well, I know
Just because
that.
I'm gay and maybe have a cold, maybe a little sick, doesn't mean I'm suddenly going to infect everybody that comes into the ER room.
We can't really say for sure what you have. The fact that it's taken a long time for you to get well is an alarming situation.
So would you tell us, would you tell me or him not to be having sex with each other or with anyone else? Or
abstaining from having sex with anybody else at this point would be very wise, because as I said, we don't know for sure yet. This could be a precondition of AIDS. And Steve, I'm sure you're aware of the fact that if you have had sexual contact with John and this
is an early stage of AIDS, that you have been exposed.
Okay. The reporter's been on the phone from the Tribune. It's about the AIDS business. I told him about the transfer case. I told him about what's being done, but he wants to know about some patient we've got in who has hemophilia. I don't know. Apparently, someone is claiming that this patient has contracted AIDS from clotting factors and transfusions he received here. I don't know anything about it.
Oh, what'd you tell him?
I couldn't tell him anything about the hemophiliac. I told him about the case in ICU. I told him about infection control procedures. I told him not to print anything until I could get back to him. He told me the guy's name.
Oh, God.
He's Dr. Hunter's patient. He's on 4 West. Well, Dr. Hunter is out, and the charge nurse is being no help at all. Can you give me any information? Please.
Don't tell me that it's confidential information because I know that it isn't. No, it isn't. I want to know who the donors are. I also want to know what their background is. And I also want to know whether any other cases of AIDS have come out of this particular batch. My son has been on factor 8 for 6 years.
Well, we're going to tell you all this.
I know you're going to tell me all this, but when?
Well,
I would also like very much to know what tests you're going to do to tell me whether or not my son has AIDS. I know that you will tell me. When are you going to tell me? Who is going to tell me?
Everybody right now is trying to do
Where is Dr. Hunter?
He is down. I'm sure he's with the people.
Would you please buzz him or page him or whatever it is that you do?
Yes. I think if you just relax.
Are you aware of the fact that there is a group of people in this town, all of whom have children like my Bobby?
We are.
So it's not just me that you're dealing with.
No, we know that.
And are you also aware of the fact that my husband is a friend, a very good friend of Ralph Williams at the Tribune?
Okay, now I don't think that's quite necessary.
No,
it's not necessary as long as something's done. But if something is not done, then it will be necessary. So when you ladies have something to show me, would you please let me know?
Yes,
all right.
will.
Okay, then get him up here, please.
What are you going to do with her?
Oh, God, I don't know what to tell you. You know, the kid was brought in. He's been really sick for about 2 weeks. His mother's very upset. She's convinced that it's AIDS. She's been giving Dr. Hunter a very hard time. We don't have the capability in our lab to do the T-cell tests, so we've had to send them out to San Francisco to a lab, and they're not going to be back for about 3 days. Oh. Dr. Hunter's convinced the kid just has a case of the flu. The kid's had a lot of factor 8 whole blood transfusions.
We've got to do something. Otherwise, the headline's going to scream, AIDS epidemic sweeps Memorial Hospital.
Well, you're right. Now, listen, if he has any more questions about transfusions or risk, then you just have him call me, okay? You're right. This can really get out of hand if any misinformation gets out. Okay?
Okay.
Okay.
Thanks.
Sure enough.
Bye-bye.
Wow, things have gone downhill since the beginning of the morning, I'll tell you. 3 of our nurses did not show up for shift change.
Oh, Lord.
We've got very young and dedicated nurses, but they're really not comfortable. They're uneasy with the situation. They're double gowning, double gloving, wearing goggles.
Do them any good? I was hoping that little pep talk by Dr. Miller had solved most of the problems you might have.
I'm sure it did. I mean, at the time, it did. The pep talk was great. But at the same time, we have other doctors who aren't as progressive as he is, and we're having some problems.
AIDS cover-up at Memorial Hospital. We have a public relations disaster on our hands. In case anyone wonders how serious this happens to be, admissions called me and told me that we had 3 cancellations. This paper's only been on the street 2 hours, and we have 3 cancellations. Now, we need a policy on how we're going to deal with employees that refuse to handle an AIDS patient. We have a lot of nervous people around here. Now, tomorrow morning, I want to make certain that you have a written program that will contact every single person in this hospital so that they're fully aware of what their responsibility is and what our policy is. We're supposed to have continuing education programs all the time. What is the program on AIDS? I presume we have one. There are risks involved with AIDS. It has to do with transfusions, and it is a communicable disease to some modest extent, apparently. But as I understand it, the risk is not that great. We don't need to have an uproar in this community of people worrying needlessly just because we have an unfortunate victim of AIDS. What can we do to get an immediate program to reach the media and tell a story that is valuable and not one that is alarmist? For the time being, I want you to clear everything through me. Anybody have any questions they'd like to raise at this time? Have supper brought in.
In conclusion, I urge you to make immediate recommendations as to how we might deal with the psychosocial impact of AIDS on this institution.
How'd you like to take this fellow home to your mother?
I heard about the guy they brought in.
What am I supposed to do with this, huh?
I have a cold, for Christ's sake. I don't have AIDS.
But how are people to know that, Mark?
He told me the guy's name.
I have been with my son for 14 years, and I know when he is sick and when he is not.
At our shift change, we had 3 nurses not show for second shift.